A 70-year-old male comes in due to a urinary tract infection. After he is admitted for monitoring, he becomes agitated and becomes combative. A low dose of haloperidol is given, and after vitals are rechecked, temperature is 104, blood pressure is 190/90. On exam, extremities are rigid and is difficult to induce passive flexion and extension. What is the mechanism of action of the medication that treats this disorder? So the answer choices are A, inhibits enzyme acetylcholinesterase, B, inhibits dopa decarboxylase, C, prevents calcium release from sarcoplasmic reticulum of the skeletal muscle, and D is inhibits enzyme monoamine oxidase. So I'll let you answer and then I'll explain it in 5 seconds. Okay, so the answer is going to be C, prevents calcium release from sarcoplasmic reticulum of skeletal muscle. So the first thing you have to recognize for this question is that it's neuroleptic malignant syndrome. So this syndrome is typically caused by antipsychotics. So in this case, the antipsychotic that was given was haloperidol, and sometimes they do use it when the patient experiences agitation and combativeness, likely due to delirium. So in elderly patients, what happens is when they are admitted to the hospital, since they are in a different environment, typically the lights are going to be on and people's normal circadian rhythms are disrupted. This actually causes people to go into delirium, which is a state where their consciousness goes in and out, and then they can become very confused. And so this is a transient disorder, but needs to be treated. And you can typically use conservative measures such as turning off the lights at night and trying not to disturb them so they get a good night of sleep, and also trying to constantly reorient them, telling them that they are in the hospital. So these are typically used for delirium. And then the actual medication that they gave was haloperidol, and unfortunately, one of the side effects is this neuroleptic malignant syndrome. So let's talk about that a little bit more. And so a mnemonic used to remember the symptoms and signs associated with NMS are fever. So it's going to be F for fever, E for encephalopathy, a V for vitals unstable. So this is just autonomic instability, and that's why you see the vital signs going crazy. And then elevated CK, creatinine kinase, and then finally rigidity. And so sometimes they might say lead pipe rigidity, and that just means that essentially the arms and legs are stiff in extension and it's tough to get them to move. And so typically people are just normal, you're able to bend their arms and legs even when they're unconscious. But in this case, since they are undergoing neuroleptic malignant syndrome, their extremities are rigid in this case. And so once again, like I was saying, you use supportive measures to treat NMS. But the thing is, as a adjunct, you can use dantrolene. And so dantrolene is a medication that prevents the release of calcium. So calcium is typically stored within the sarcoplasmic reticulum of the cell, and the ryanidine receptor is what usually causes, and if this is activated, it causes the calcium to be released, and thus it can cause contraction. So if dantrolene can prevent this ryanidine from being activated, now you don't have that calcium released. If you don't have calcium released, you don't have contraction of the muscle. And so obviously in this case, it'd be good because we want to get rid of this rigidity. Okay, and so just talking about the other different medications and mechanisms of actions listed. So we also have Denipazil. So in this case, it inhibits acetylcholine esterase. And so that's just the enzyme that breaks down acetylcholine. So in this case, we're inhibiting this enzyme. So, but this thing is typically used for Alzheimer's. So this wouldn't be useful in this case. Next one is dopa decarboxylase inhibitor. It can be a drug called carbidopa, and it can be used with levodopa. And this is typically used to treat Parkinson's disease. Now, in Parkinson's disease, the typical problem is low amounts of dopamine. Now, you might think of dopamine as the pleasure hormone, and it is, but it's also associated with movement. So that's why people with Parkinson's have movement disorders as well. And so the treatment of that is to give them just what they're missing, a little bit more of dopamine. And so that's what this drug does by inhibiting the enzyme that breaks down dopamine. But once again, this wouldn't be useful for NMS. And then finally, we have selegiline. And so this one inhibits monoamine amine B. And so once again, this can increase levels of dopamine, which is what we want in Parkinson's disease. And so this just inhibits it, but once again, this wouldn't be applicable to NMS. So in this case, really, you just had to follow and recognize the clinical pattern or presentation of NMS following an admission of an elderly person, especially after they become agitated and combative. So likely indicating delirium. So the first step is they're admitted, and especially in elderly patients, they become combative, they're given an antipsychotic, and then after being given that antipsychotic, you end up having these unstable vital signs and the trouble with the extremities of having extreme rigidity. And so the thing is, even after recognizing all of that and recognizing that's NMS, then they want you to not only tell the treatment essentially, but the mechanism of action of that treatment, which is going to be dantrolene, and then the mechanism of action is going to be of dantrolene is going to be prevention of calcium release from the sarcoplasmic reticulum of the skeletal muscle. So I hope that helped, and thanks for watching.